Well, EBUS is a endobronchial ultrasound, a technique that has been practiced by specialists in lung cancer for the past 30 years or so. It is used to pass a bronchoscope into the airways of a patient, and using a small ultrasonic probe at the end of the tube, it allows the operator to image through the ultrasound the lymph nodes and the tumor that a normal bronchoscope is not able to access. So it has enhanced our diagnostic capacity as lung specialists in the treatment and diagnosis of lung cancer. That's a good question. The bronchoscope is the traditional fiber optic endoscope, which is passed usually through the nose or the mouth into the airways, and it has an optical camera at the tip of the scope, which is then projected onto a screen. The endobronchial ultrasound is similar to the bronchoscope, but in addition to the fiber optic camera, it also contains a ultrasonic probe at the tip, which allows for imaging of ultrasound to be projected at the same time as the fiber optic images. Well, EBUS can be used to diagnose a whole range of lung disorders and also other disorders, primarily hematological conditions. But from a lung perspective, we often use it in the diagnosis and staging of lung cancer, because the lymph nodes in the mediastinum, which is the central structures of the thoracic cavity, cannot be accessed easily by any other means. With the endobronchial ultrasound, the images can be projected onto a screen, and with a small needle guided by the ultrasound, lymph nodes can be aspirated, which we call a transbronchial needle aspiration, and the cells be studied under a microscope to clarify the diagnosis. EBUS is useful because it is not just used in lung cancer, but can be used for other conditions such as lymphoma, tuberculosis, sarcoidosis, and conditions that cause enlargement of the mediastinal lymph nodes and the hilar lymph nodes. So it is a very versatile tool that is being used for many purposes. EBUS is generally performed under conscious sedation. By this, I mean that the patient is given some sedation through an intravenous cannula. The medication is a short-acting drug, which normally causes the patient to be relaxed and sometimes asleep for up to about 30 minutes. Local anesthetic is applied to the throat and to the mouth to numb those areas where the scope is passing through. And the patient is normally, if not asleep, then very relaxed during the procedure that in my hands normally lasts about 15 to 20 minutes. No, EBUS is not painful because we use generous amounts of opiates or morphine-based drugs. We also use local anesthetic and sedation, and by and large, patients are asleep. They may feel an unusual sensation of a tube passing down the back of their mouth into the throat, but apart from that, it is not a painful procedure, and patients are generally able to go home the same day after the procedure. It varies from department to department. In our institution, the samples are sent straight to the pathology lab, but the processing normally takes about 5 working days. And we normally discuss the results in about 5 to 7 days following the procedure itself.